Hello and welcome to Comcast Newsmakers. I'm Candace Kelley, and today's newsmaker is Amy Comstock Rick. She's the CEO of the Parkinson's Action Network, and today we're going to be talking about Parkinson's disease and the Affordable Care Act. Thank you so much for being with us today.
Thank you.
You have done a lot of research and a lot of going through and doing things that a lot of people really couldn't do in terms of going through the act and figuring out what's pertinent to them. What are some of the key points that you want to make sure people understand when it comes to Parkinson's disease and the Affordable Care Act?
Well, certainly the Affordable Care Act has multiple provisions, and I think it's very important for people and even disease communities to go through and figure out what is relevant in the Affordable Care Act to them. The hot topic right now, of course, is the marketplaces or exchanges where people who either don't have insurance or in some of the covered groups can go to sign up for insurance, and that opened up on October 1st. But a lot of people don't realize the many communities that were impacted either by other parts of the Affordable Care Act or not at all. For example, people on Medicare now, which many people with Parkinson's disease are on Medicare, they don't need to do anything. Medicare, their Medicare coverage was not impacted by the Affordable Care Act in terms of 2013. If I may, the Affordable Care Act, which was passed in 2010, had two provisions that is very important to people with Parkinson's, but they were put into place 3 years ago and still in place. One is that there can be no elimination or exclusion from insurance because of pre-existing condition. You can't be discriminated against. They can't charge you more.
And that's a big deal.
That's huge.
Yes.
For someone with Parkinson's disease, a progressive neurological disease, to not be discriminated against or charged more because of your condition is huge. And of course, this is not just Parkinson's. It's for any condition. And in addition, insurance companies can't have lifetime coverage caps anymore, which for many conditions that are expensive, that was a real issue. So those two have been in place for 3 years and are really important to our community.
Now, certainly we've been hearing a lot about the Affordable Care Act, and in your studies of it, what is it that you also want people to know about it in general? Because there's a lot to go through, but I'm sure that you are, more learned in that area. What should people understand about it?
Well, there's a lot of good resources out there. Because we're all different with our own issues and our own sources of income, whether we're employed or not, what our particular health conditions are. People really have to go through and do a little bit of learning for themselves. So the government has created healthcare.gov, which is where people can go to learn about what's appropriate for them and what's being offered in their states. But in addition, on our website at parkinsonsaction.org, we've created a lot of materials that are designed for the Parkinson's disease community, but they would be relevant to people who have chronic conditions. And what, again, we're finding most interesting is a lot of people don't realize there's so much talk about the Affordable Care Act now that they may not be impacted by it.
Right.
If you're covered by your employer for your insurance, you're good to go. If you're under Medicare or the VETS VA program or TRICARE, you're good to go. So
a lot of people might be a little scared, and they may not necessarily have to be scared.
They may not have to be scared. And if they are scared, which is completely understandable because it's such a deluge of information, go to our website, go to healthcare.gov. There's a lot of resources out there, and people can walk you through whether you need to do something or not, and then if you do, what your options are, and there really are options.
And so again, there are materials on your site that are very informative, boiled down information that could be pertinent, not just to people with Parkinson's, but anybody else. What's the #1 question that you get? Is it about whether or not I'm covered or not?
It is, what do I need to do? And again, I think it's been a good effort to make sure people are aware of this, but not everyone has to do something.
All right. Well, I want to thank you so much for walking us through that very difficult topic, and I appreciate seeing you and having you here today.
Thank you.
I'm Candace Kelley for Comcast Newsmakers. If you want more information about Comcast Newsmakers, you can visit Comcast On Demand and click Get Local.